Medicine is a difficult thing to comprehend, yet every day scientists all over the world are finding new and better ways of treating patients. Here are some of the most astonishing medical breakthroughs as of late. 20. No heart, but 2 pumps. When Dejana Simmons was 14 years old, she underwent heart transplant surgery to replace the enlarged one she had. It didn't take long for doctors to see that her body was rejecting this new organ. The surgeons had no choice but to remove the heart, though there was no other heart available to replace it. To keep Simmons alive, they used 2 external mechanical pumps. She lived for 118 days without a heart. Even though she suffered kidney and liver problems, she eventually was given a new heart that her body accepted, and she made a full recovery. 19. Drones distributing medicine. In 2016, the Silicon Valley startup company called Zipline International announced that they had plans to fly drones carrying prescriptions and blood to patients in Rwanda. It was the world's first drone delivery system to travel at an international level. Zipline chose Rwanda because it is one of the poorest countries on the globe and is also a country making strides to improve its healthcare system. 18. The Christmas Miracle. In 2008, a window washer named Alcide Moreno was at work with his brother when they fell 47 stories. For 3 weeks, Alcide was in a vegetative state. Then, on Christmas Day, Moreno spoke. A month later, doctors discharged him and he was walking again within the year. The only signs of his accident are a long scar on his left leg and a slight limp. 17. Next generation vaccines. Keeping up with new diseases or existing diseases that are evolving is not an easy process. The development of one vaccine costs an estimated $200 million. In 2018, experts began upgrading the manufacturing of vaccinations. First, they attempted to accelerate the process of developing vaccines by using plants or insects instead of incubating viruses in chicken eggs. They also thought to freeze-dry the vaccines so that the immunizations may be transported to remote areas faster and more effectively. 16. DNA modification. Gene therapy is the practice of modifying a patient's DNA to treat diseases, as opposed to treating symptoms like a lot of medications do. Scientists use DNA modification to treat illnesses like breast or blood cancers and skin diseases. One of the most significant medical breakthroughs of last year was the newly refined technique of editing embryos. This method means doctors can edit DNA in an embryo to avoid genetic diseases. 15. Blind man sees again. For over 10 years, Martin Jones was left blind following an accident at work. He needed to wear a body stocking for most hours of the day since his body was 37% burned. Doctors removed his left eye, though Jones was unable to see in his right eye. Surgeons at the Sussex Eye Clinic in Brighton came up with a procedure that involved extracting Jones's canine tooth and implanting it into his eye. The tooth was fashioned into a lens and then placed in the eye. Eventually, his eyesight returned. 14. The artificial pancreas. A person with diabetes has a pancreas that is not producing enough insulin for their body. There are different types of diabetes. Type 1 usually requires patients to receive insulin injections. Type 2 can be treated with medications, with or without insulin. Most people with this chronic illness are told to exercise regularly and restrict their diet. Sometimes they need to go through surgery. In 2017, the first artificial pancreases were released on the market as a way for diabetics to manage their insulin levels. 13. Twins are saved. Couple Shannon and Mike Gimble were faced with an excruciating, difficult choice. Their unborn twins had twin-to-twin syndrome, or TTTS, meaning that their 2 daughters were connected by blood vessels. Doctors told the Gimbles that they needed to choose one in order to save the other. That's when Dr. Kent Hayborn stepped in and offered them a different approach. His team, along with a group of doctors at St. Mark's Hospital in Salt Lake City, worked together to perform laser surgery in the womb to cauterize the connected blood vessels. In the end, both girls survived. 12. Heart in the box. Have you ever wondered how organs used in transplants arrive at the hospital? For the past 50 years, the organs were packed into a container of saline and ice and then delivered to the surgeons. However, the packages risked injury on the way. Researchers at the University of Minnesota came up with a device named the TransMedics Organ Care System, also known as Heart in the Box. This process entails the organs to be stored inside the device, which is sitting on a cart at waist level. Inside the box, the organ can stay in the donor's oxygenated blood while being transported with a smaller risk of injury. 11. Reducing LDL cholesterol. There are different types of cholesterol. Some of it is good and some of it isn't. The bad kind of cholesterol is called LDL. When your LDL levels are high, that's when you need to look for a lifestyle adjustment. A new cholesterol drug was approved by the FDA 4 years ago. In 2017, patients reported a 20% reduction in LDL. This medication proved to be powerful and quite possibly significantly decreasing the occurrence of heart problems and strokes in people with excess LDL. 10. Ease your mind with your gut. There's a variety of microbes in our digestive system, and scientists have discovered these bacteria affect the way we think. Gut bacteria treatments, or microbiome therapy, is when you utilize the body's bacteria to treat various illnesses. Such ailments include things like Crohn's disease, ulcerative colitis, cancers, mental illness, and allergies. It looks like you should thank those tiny things that make up our intestinal flora. 9. Augmented reality for surgery. A room full of people in white lab coats wearing VR goggles on their faces seems like something out of a sci-fi movie, but it's already part of our reality. The HoloLens goggles were made to assist surgeons by showing them images of the body that they can't normally see. The HoloLens projects 3D images onto real objects, which can be essential for blind surgeries, where experts need to rely on CT scans and basic landmarks of where organs should be. 8. Post-surgery recovery. Leading up to a procedure, doctors urge people not to eat or drink. Once the surgery is done, the tricky part isn't over, not for the patient. There have been many advances in the way operations are completed, but not as many for how the patient will feel immediately afterward. The road to recovery after doctors stitch you up is a gradual one. Now, researchers are hoping to accelerate the healing process, and with new studies being conducted to improve the enhanced recovery after surgery protocol. ERAS is complete with nutrition plans and information on various methods of pain relief that's alternative to typical medication. 6. A peaceful sleep. Sleep apnea is a potentially serious sleep disorder where a person's breathing repeatedly stops and starts throughout the night. There are different types of this condition. Severe sleep apnea can be uncomfortable and dangerous. Surgery is usually the last resort because it can obviously have serious side effects. Recently, the FDA and USDA approved of a new, less invasive technique called the Remedy Sleep System. It is an implanted device that activates nerves to send signals to the diaphragm and stimulate breathing. 5. A fishy way to heal burns. In 2018, veterinarians at UC Davis were able to treat mountain lions and bears suffering from second-degree burns by using fish skins. For animals, using fish skin was a plus because it was an edible alternative to gauze or other bandages that would normally be harmful to a creature if ingested. Fish skin bandages can be left on for 2 weeks. The vets used tilapia skins, which act as a dermal substitute that also provides protection and pain relief. The tilapia also offered a lot of moisture, which prevents scarring. Can this be applied to humans? Professionals say yes. 3. Custom 3D printing. You've seen all the items you can make from 3D printing, from mugs to fidget spinners. Remember those? Now the art of 3D printing can be used to treat those that need replacements for body parts or implants. This revolutionary way of manufacturing objects paved the way for experts to create patient-specific products that lower the probability of complications. Not only can researchers print out external prosthetics like hands and legs, but they're also working towards 3D printing organs. The first 3D partial liver transplant is expected to be possible by 2020. 2. Mind over matter. A new technology introduced a short time ago has changed the game in how doctors could treat those affected by ALS. When amyotrophic lateral sclerosis happens, a person may be able to have regular brain functions, but they can no longer move their body. 2 years ago, an international team of scientists was able to communicate to the completely locked-in patients through a non-invasive computer-brain interface system. The system proved it could decode the patient's thoughts, while scientists were asking them yes or no questions. The study is still in the beginning stages, but it appears to signal great things for how to go about this condition. Before we tell you number 1, we've got a question to ask. If changing your DNA gave you superpowers or affected the way you look, what would you change? Let us know your creative thoughts in the comments below. 1. Hello, Dr. AI. If you thought a world where robots worked as healthcare professionals was far in the future, we're here to say it's a future that's closer than you think. In the late 2000s, robots were already in operating rooms. Artificial intelligence replacing professionals for specific tasks can prevent physician burnout. AI can view scans more accurately than a set of human eyes and also assist doctors in making better decisions. They can make sense of vast amounts of data in more efficient time and provide immediate image analysis. Who knows? A decade from now, you might be greeted with your new AI doctor.